preventing miticide resistance, keeping our mite management tools in the toolbox. What is resistance? The development of an ability in a strain of an organism to tolerate doses of toxicant which would prove lethal to the majority of individuals in a normal, susceptible population of the species. We have witnessed chemical resistance to varroa treatments in other countries due to repeatedly using the same chemical classification. Chemical resistance can also occur if we don't follow the product label. The instructions must be Australian or an Australian Pesticides and Veterinary Medicines Authority, APVMA, registration or permit for use. Not applying the correct dose, so half treatments. Not adhering to the treatment time frame, so shorter treatment times. Not removing the treatment within the treatment time frame, so exceeding treatment time, all bad practices that will help develop chemical resistance. Chemical applications ensure an effective dose is administered for the duration of the treatment. If exceeded, a less effective dose is delivered, leading to possible resistance. Chemical effectiveness on the target is worked out, and this is why it is removed at the completion of the treatment time. If strips do fall through between frames in your brood box, retrieve them. Non-approved products or home remedies are exactly that, with no testing to see what impacts it may have on human or honeybee health or hive product contamination. Importantly, not applying more than one treatment at a time. Treating prophylactically where there's no mite level. Prophylactic means preventative. There is no point treating if mites are not present. It is unnecessary chemical use and will not prevent varroa from infesting your hive post-treatment and can also lead to chemical resistance. It's also unnecessary chemical use. Remember best practice beekeeping, replace those old brood frames that have had treatments on a regular basis, approximately 3 years, and that's due to some chemicals accumulating in wax. The mode of action is the way a treatment acts on the target. This may be nervous, muscle or respiratory systems of the target pest. If we look at the product name and or active ingredient, we may assume that these treatments would have a different mode of action, but we need to look at the chemical class that the treatment comes from. Baverol and Apistan, different name, different active ingredients, but they are from the same chemical class, synthetic pyrethroids, therefore have the same mode of action. Apivar and Apitraz have a different product name, but same active ingredient, and same chemical class, being a synthetic formaldehyd. Products with the same mode of action should not be used back to back or sequentially, and some may only be used once or possibly twice per year. Managing varroa in the early stages of establishment, it may be tempting to only use the one product for control of varroa. A word of warning. As found in other countries, continual use of the same treatment quickly assists the varroa to become resistant, and we lose a valuable tool in our fight against varroa. And just to note there, non-synthetic chemicals can also be incorporated into your treatment plan, as these have a reduced potential for mites to develop resistance. If we follow the Australian Chemical Instructions or APVMA permit, are aware of the different modes of action of particular products, plan and rotate our product use, and where possible implement IPM into your beekeeping, we can extend the effective life of a chemical treatment and keep it in our toolkit as a mite management solution.